Directed energy weapons and their effect on the brain, the mysterious neurological symptoms known as Havana syndrome, were primarily documented among American diplomats and intelligence personnel stationed overseas. But now, is the threat a domestic one too? And could symptoms be linked to directed energy attacks? Remember, directed energy weapons are invisible weapons that fire concentrated energy at the speed of light. We're joined now by Professor Emeritus of Neurology at Georgetown, Dr. James Giordano. He also served as a forensic neuroscientist on the original Havana cases. Great to see you, Doctor. Thank you so much for being here. So we've been covering this. It's scary when you hear about it happening to CIA officers overseas, people in the military, but have you seen any evidence of directed energy use here on American soil?
There are several instances of individuals being hit in what appears to be both sonic energy and forms of rapidly pulsed microwave energy domestically. Some cases in Florida, some cases in the Delaware, Maryland, D.C. area, and some cases on the West Coast as well.
So I want to get your response to this because we spoke to investigative journalist Catherine Herridge recently, and she had this to say about these types of weapons. Listen.
Well, based on my reporting, there seem to be multiple types of weapons. I think what I'll call the old school style weapon are weapons that are built into the infrastructure. Many of the people that I've spoken to say they were attacked in hotel rooms. They were essentially had their brains kind of fried overnight. I mean, that's the simple explanation.
So what kind of capabilities do these weapons have in addition to what she's exposed? And, do they have a potential to be deadly?
Yes, ma'am. So in my conversations with Catherine Herridge, and I really thank her very much for the depth and stringency of her reporting, she's absolutely right. There are essentially two generations of these weapons. The first seem to be sonic weapons working in the ultrasonic range, and they tend to produce an overexcitation in hollow cavities and fluid-filled cavities, like the inner ear, but that can also communicate through the bloodstream to the brain to create something like a mini stroke-like effect. Those original injuries in Havana, as you may recall, were originally referred to as the immaculate concussion. But then subsequent generations of these types of weapons, these types of devices, also produce very rapidly pulsed microwaves that don't have a thermal signature and that utilize a laser to pulse the microwaves very, very quickly so that the waveform is preserved, but without the necessary thermal signature, no heat, and without the need for large power sources. It'll make these very, very scalable. Now these operate differently. They actually disrupt the neurological integrity of the nodes and networks of the brain, both in the short term, but then certainly in the longer term, where you're then seeing subacute and more chronic effects on the autonomic system, heart rate, immune system, endocrine function, and these can be very debilitating in the long term.
So we were just showing a graphic on the screen about how the U.S. government uses these directed energy weapons to, push back drones, to push back, military forces. But we have seen this happening here based on the reporting that we've just been talking about. The concern is that this could be used in a backpack by, a Russian spy or someone who could walk right up to something like the Executive Office building in Washington, D.C., or other government buildings and direct this energy towards people working in that building. You talked about scale. We worry about drones all the time because they're scalable. You can fly one into, a stadium. You can fly one over an event. It seems like this is similar in the sense that you could put it into a small backpack or other portable way of getting it somewhere and use it against someone. So how do we combat that as a government and make sure that people are being safe, especially here at home?
That's correct. Well, the scalability of these weapons is certainly one of the areas that have been progressed over the past 6 to 10 years. Now, at this point, they're not scalable to the point of being mounted on very small scale drones. But to your point, they are backpack mountable, and they're certainly mountable in vehicles, vans, automobiles, which then makes them very viable for clandestine or even covert attacks in public, on the street, on the sidewalk, in domiciles. So the question then is, what do we do about it? Well, I mean, the first part is very important. We have to define that these things are real, the technology is there, it's not science fiction, it's not fictional fantasy ray gun stuff. The technology exists, and it exists at a point that can be weaponized, and is being weaponized by our peer competitors and adversaries, and now these are being used domestically, number one. Number two, we're developing mechanisms of detecting these at a distance, in architecture, and then personal detection systems as well. And then number three, we defend against those types of things in a number of ways, by blocking the actual signal in the wave, by producing types of garments that would deflect them if individuals are targetable, but also an early stage detection of the biological effects so that individuals can be treated early, promptly, and continuously as needed. Now, the next stage is a larger scale of defense, what we sometimes call left of bang. In other words, what could we do on a global scale to begin to guide, govern, control, and regulate these types of weapons? And there's been some progress being made on international signatory treaties, for example, the Biological Toxins and Weapons Convention, to include directable energies as a viable form of bioweapon.
While some patients experience little to no side effects during radiation therapy, most experience at least some degree of local treatment-related issues that are usually short-lived. Infrequently, patients can experience chronic or long-term symptoms. The short-term side effects of radiation usually appear days to weeks into treatment and can last for several days to weeks after completion. The most common short-term side effect is intermittent fatigue, a sense of physical exhaustion that is not alleviated by sleep or rest. Outside of fatigue, symptoms are directly related to the area of the body being treated and rarely occur outside of that area. For example, nausea and vomiting most commonly occurs when a significant portion of the abdomen or pelvis receives radiation treatment. Other factors that can contribute to side effects include the amount of radiation being delivered to an area and the recent history of other oncologic care, such as surgery or chemotherapy. So, examples of side effects could include the following. When a patient is receiving radiation to the brain, it can lead to local or global hair thinning or loss. Side effects associated with treatment to the local head and neck include taste changes, mouth dryness, swallowing difficulty, sore throat, mouth sores. With radiation to the breast, you may experience skin sensitivity, including dryness, irritation, itching, or blistering. Side effects from treatment to lung, central chest may include pain with swallowing, increased shortness of breath, or cough. Radiation treatment to the prostate may have side effects such as urinary changes, more frequent or uncomfortable urination, loose or frequent bowel movements. When a patient is receiving radiation to the abdomen or pelvis, it could lead to nausea, vomiting, or diarrhea. While these short-term side effects are usually mild and decrease with time, a small portion of patients may experience long-term side effects. Depending on the affected area, these long-term symptoms could include chronic dryness or swallowing difficulty, taste changes, chronic changes in urinary habits, rare intestinal irritation requiring surgical correction, infrequent effects on fertility, aggravation of baseline erectile dysfunction, heart or lung problems, cognitive impairment, osteoporosis, hypothyroidism, or lymphedema,